All right, Supervisor Miley.
Yeah, I'd like to speak to this matter because this ordinance will primarily affect constituents I represent in District 4 in the unincorporated area. I know Supervisor Chan and Valle and Haggerty represent constituents in the unincorporated area as well, but I represent probably the vast amount of those constituents. So I've been involved with this ordinance since its inception. In fact, I think Supervisor Haggerty and Chan might have brought this up years and years ago, maybe 3-4 years ago, when e-cigarettes first became more of an item. And it's been floating out there for discussion for quite a while. The Unincorporated Services Committee has heard this matter on a number of occasions, and I know it's come to the Health Committee on a number of occasions as well. And the ordinance before us is the ordinance, I think that it's gone through the Health Committee. There is a difference of opinion both in the unincorporated area among our constituents whether or not such an ordinance regulating e-cigarettes as tobacco products is necessary and appropriate. I think my position, I think the position of everyone is that e-cigarettes need to be regulated, but not as a tobacco product, because there's a difference of opinion professionally whether or not it's a tobacco product. The Public Health Department has made its case and tries to make its case that it's a tobacco product, as well as other people. But I know there are jurisdictions and authorities both in this country and in England that maintain that e-cigarettes are not tobacco products. In fact, it's sort of like if you take to make it a tobacco product, it would be like if you're vaping, you're saying that. For instance, if I have a cup here and I put water in it, I'm saying that this cup should be, anything that comes in this cup should be considered, let's say, alcohol because it's in this cup. Whereas I could be putting milk in this cup, I could be putting soda in this cup, I could be putting coffee in this cup. So an e-cigarette is just a delivery device. In and of itself, it's not a tobacco product. And so an e-cigarette should be regulated, but not as a tobacco product. I think the board has received correspondence from me stating that I feel very strongly that e-cigarettes should be regulated, but not as a tobacco product. I think it can be regulated similar to a tobacco product, but not defined as a tobacco product. We've had experts talk with us, and one of the experts is Dr. Siegel from Boston University. He's a professor. He actually worked with me when I was on the Oakland City Council back in the 70s, and I pushed the effort to address smoke-free restaurants when that was something new and was a cutting edge, and also was something that, once again, hadn't been taken up. And he, along with a lot of people, worked with me on that, and we pushed for smoke-free restaurants and a number of other laws dealing with tobacco. So it's not as though I have any problem with regulating tobacco and keeping it out of the hands of minors, et cetera, but I do have a problem with demonizing e-cigarettes as a tobacco product when it's not definitive in the scientific community that is indeed a tobacco product. There are people that are maintaining that it's a tobacco product, and they might be maintaining that it's a tobacco product because they want to continue to provide funding for the tobacco masters, for tobacco settlement, so that we can secure public health on the backs of tobacco products and encourage people to in effect, to continue to try to promote tobacco use so that we can have money in the tobacco fund. And once again, having e-cigarettes defined as a tobacco product helps to promote that. From Professor Siegel's information, and I've provided a copy of this for the board. It's on YouTube, and also I've provided a copy of some of the written information. Professor Siegel points out that these products were not developed by the tobacco companies, and I'm just paraphrasing. I'm not going to go down and read everything. The research clearly shows that e-cigarettes are much safer than conventional cigarettes, that these products really work for smoking cessation, that despite the widespread hysteria being spread in the media about e-cigarettes serving as a gateway to youth smoking, the actual evidence demonstrates just the opposite. And And finally, the most important thing, and I'm going to read some of this because I think it is the most important thing that makes electronic cigarettes different and which truly makes them a game changer is that they are not tobacco products. Specifically, electronic cigarettes do not contain tobacco. The e-liquids do not contain tobacco. The only reason they have been referred to as tobacco products is that under federal law, these products cannot be regulated as drugs. Thus, they are being regulated under the Federal Tobacco Act. But it is critical to understand that there is no tobacco whatsoever in electronic cigarettes or other vaping products. To call them tobacco products is not only wrong, but it deceives the public into believing that they contain tobacco, which distorts the public's understanding of the relative safety of real tobacco cigarettes compared to electronic cigarettes. No one disputes the fact that electronic cigarettes should be regulated, especially in terms of requiring licenses for e-cigarette sellers, preventing the distribution of free samples, banning the sale of e-cigarettes through vending machines, restricting self-service displays, and requiring identification for purpose to keep these products out of the hands of minors. And also, for that matter, trying to determine what is actually being the products that are, or the ingredients that are in e-cigarettes. However, I believe it is critical that electronic cigarettes be regulated not as a tobacco product, but as a separate entity under vaping products. Classifying and regulating electronic cigarettes as tobacco products is causing considerable public harm. By confusing the public into thinking that these products contain tobacco and are simply another method of smoking, the public has been deceived into thinking that electronic cigarettes are just as hazardous as smoking. This is undermining decades of public education about the severe hazards of smoking. Surveys have shown that over the past 4 years, the public's appreciation of the hazards of smoking has decreased. But many people falsely believe that smoking is only as bad as using a vape product. The unique hazards associated with the use of tobacco have been obscured. And then he goes on to say that there is currently, and this comes to the whole issue around vaping and whether or not it causes a health hazard. There is no evidence, and there's dispute around this, that secondhand vaping has any significant adverse health hazard or health effects. In fact, there is no study which documents that under actual conditions, the use of vaping products in public places results in significant exposure of bystanders to toxic chemicals or that it impairs their health in any way. So he continues, and I'm almost done. He questions whether it makes sense to focus on banning vaping even in outdoor areas when there is no evidence of any substantial public harm or public hazard. It is not clear to me why the board can justify the interference with the autonomy of private business in the absence of evidence that secondhand vaping is actually causing adverse health effects. So I don't think e-cigarettes are tobacco products, and I do think they need to be regulated, but not as tobacco products. I don't think we should be demonizing this product. I know there are people that are using these to get off of smoking, and to demonize it, all this is going to do is maybe encourage people to continue to smoke. Also, the fact that people, when they're vaping together, it's a social activity as well, and it helps to try to diminish the desire to even want to move down the road of smoking. It's not been proving that this is a gateway to tobacco, the use of cigarettes or tobacco products. But it's a way of getting off of tobacco, and it's also a way of not even wanting to go and use tobacco products. It's a lifesaver. It's a game changer and a lifesaver. So for that reason, I'll be opposing any ordinance that tries to equate e-cigarettes with tobacco products, but I would support an ordinance that has us regulate e-cigarettes on its own merit as a vaping product, because once again, an e-cigarette is a delivery device. It's sort of like this cup. This cup is a delivery device for liquids. I can put anything in this cup. With an e-cigarette, I can put anything in the e-cigarette, in the vaping device. So now, are you going to say we're going to call a cup, and we're going to call it alcohol, when it's in a cup, just because it's in a cup. So we're going to say that anything that's in a cup is now to be defined as an alcohol product because it's a cup. That's what we're doing with e-cigarettes. We're saying if it's a vaping device and it's in there, we're now defining it as a tobacco product. And it doesn't necessarily mean that it is indeed the case. Once again, it's just a delivery device. It's not in itself a tobacco product. That's all I have to say for now.
Hello, my name is Ramelia Braithwaite. I am a business owner of Tasty Vapor, a vape shop in Oakland, California. Tasty Vapor has been operating in Alameda County since January 1st, 2010. Thank you so much for the opportunity to speak on the topic. I strongly oppose Item 18 to include electronic cigarettes in tobacco sampling, tobacco retail, and smoking restrictions. I understand this is not a ban on electronic cigarette sales or use of these devices where smoking is allowed. What's proposed is still a step backward in public health. Smoking bans protect people like me from secondhand smoke. However, numerous studies have shown that electronic cigarettes do not pose a risk to bystanders. The ability to use electronic cigarettes in public spaces will improve public health by inspiring current smokers to switch to electronic cigarettes, thus reducing their health risks by an estimated 99%. Losing an ability to test electronic cigarette-related products in my shop before purchasing will have a negative impact on my customers' ability to purchase the product. This alone will result in decreased sales and potentially put me and my employees out of work. Being in this business for over 6 years, I'm privileged to hear powerful stories of longtime ex-smokers summed up in 4 simple words: vaping saved my life. I'm also privileged to witness my husband's health transformation after his switching to electronic cigarette. His health has significantly improved, thus saving us a lot of money in doctor's bills. Please do not deny current smokers an opportunity to switch to electronic cigarettes and potentially improve their health. I urge you to exclude electronic cigarette and tobacco sampling, tobacco retail, and smoking restrictions. Thank you.
Good morning, Supervisor. Go ahead. My name is Jeff. My bad. Okay. My name is Jeff, and I am also the co-owner of Tasty Vapor. It's an 8,600 square foot facility in Oakland. We manufacture the e-liquid for electronic cigarettes. We've been doing it since 2010. Before I began this company, I was a 27-year smoker. I've gone through the gambit of the approved cessation products, the gums, the patches, compressed tobacco pills, any number of them. All of them have failed. Looking at it further, it was made clear to me that 95% of these products have a failure rate because ultimately they weren't designed to do the product that they claim to do until I ran into electronic cigarettes. And I made a decision, told my wife, I'm going to get this, and once I do, I'm done. And her having gone through me trying all these products, she was a little skeptical. So I don't know if the success is out of spite for her or if it just worked. But I got it, and when I did, I was done. It mimicked all the ritualistic behavior that I had associated with smoking without breathing in the cigarette smoke, without the 2 primary killers in a cigarette, which is smoke and which is tar. Also minus the catalog of around 4,000 chemicals that are used in the production of cigarette tobacco. I knew the importance of this product just enough that I made a decision to get involved in the industry. This was important for people to get. Also, me being involved in the recovery community, this was a good deal. So I made a decision to start Tasty Vapor. We grew and we grew and we grew, and now we again operate out of 8,600 square feet in Oakland, California. In reading ordinances like this, and we have been all over California dealing with ordinances like this, which is little more than an archaic way of dealing with the problem by lumping the solution in with the problem. This is not a way to deal with it. And I would invite any one of you to drop by our factory in Oakland, California, open a dialogue, and get an idea of what this is and what this isn't. We're very well educated in the matter. So I hope you'll take that opportunity before moving forward on things like this. So thank you.
My name is Melinda Morse. I'm a teacher of 37 years. I had national board certification in math, and I taught science. And I oppose the position which the previous speaker took, and I support the position that Mr. Miley has taken. It is an extremely high level of science to explore e-cigarettes. One cannot summarize it as simplified as it has been as far as whether or not we know exactly every particulate. I want to go on to say that misplaced fear with the just say no to sex didn't work. We found out HIV spread. We found out that syphilis spread. We found out there was great harm that was brought by the just say no, as opposed to offering condoms, offering safe forms of birth control to prevent unwanted children. The same thing is true with e-cigarettes. They are being mislabeled. In fact, the number one result of death, of causes of death, of causes of cost in medical from cigarettes is COPD, chronic obstructive pulmonary disease, which is brought about by years of smoking and by the tar in the cigarettes. It is not present in e-cigarettes. That is why you're hearing the absolute testimonies of the increase in health. And in fact, the Medical Association previously and probably still does provide nicotine inhalers for people with chronic obstructive pulmonary disease. Is that a small problem, COPD? No. 4.5% of the people in California have chronic obstructive pulmonary disease, a deathly condition. There are 38 million people in California, and 1.6 million of them have an extremely expensive, extremely deadly disease of chronic obstructive pulmonary disease. This is not cancer. Yes, cancer is a concern, terrible one. That means, and of those, 80% result from tobacco smoking, not from e-cigarettes. It is not related. It affects people in need, financial need, and emotional need more than it affects any others. I personally lost my dad to an infarct in his heart. I see it, I hear it in people's voices. E-cigarettes is an alternative, even if it isn't a means of quitting smoking. It is an alternative that is much healthier. It saves lives, even though it's not perfect. And by the way, minors have been disallowed from smoking e-cigarettes since 2010 in California. It has not been legal. I implore you to encourage e-cigarette as an alternative, not label it as such and try to make money off of it.
Thank you. Bob Swanson, Serena Chin, Leslie Zellers.
When I joined the Navy, I became addicted to smoking. You know, smoking lamp is lit, so you didn't have anything to do unless you smoked. And then when I was in Vietnam, cigarettes, I thought they were doing me a great favor by selling them to me for $0.10 a pack. Well, they got me addicted. And I want to tell you, my grandfather died a choking death from emphysema from smoking. My mother died from emphysema, a choking death from smoking. I have COPD, which was talked about. My father died from alcoholic cirrhosis of the liver, so my family's been hit by so-called legal drugs. I have no respect for the alcohol industry. I have no respect for the tobacco industry. But a nicotine vapor device saved my life. Among you all, I used it for 1 year in 2005. I made a rule that I would use the vaporizer during the day and smoke at night. I was what they call a dual user, and I did that off and on for a year. But after I started using the vaporizer half-time, all of a sudden I noticed I didn't choke when I went to bed. I didn't have to sleep semi-sitting up to keep the fluids from my lungs from choking me. And that encouraged me to use the vapor device more and more and more, and over a year period, I kicked tobacco. Now I had the vapor device. And over the holidays, over Christmas, when we have some time off, I didn't want to do this while I was dealing with constituents because I'd become irritable. I kicked it in 2 weeks, and it was a lot easier to kick the vapor device. Now, this is a life-saving tool, and it's being demonized. And I believe it's being demonized for wealth care, not health care. Because too many people are quitting smoking, and the master settlement agreement is not being funded well. And California has borrowed millions and millions of dollars, and there's not going to be the money to pay it back, just from tobacco alone. So the idea is you demonize these vaporizers, tax them as a tobacco product, which Tom Steyer has now funded $1 million. I talked with Tom 2 months ago about this, and his wife, Kat. And they were very surprised to find out that Healthcare England has declared them 95% safer. Their lung association, their cancer association, all their health associations are 100% behind this. There's something wrong here. Something's out of balance. And calling a vaporizer a tobacco product is absurd. They have nicotine in it, but so does eggplant. You could extract nicotine from eggplant, from potatoes. Are they tobacco products? No. The caffeine, I'm sorry, thank you very much.
Yeah, good, Bob. You know the rule.
All right, good afternoon, Supervisors. My name is Kelly Quirk. I'm the Community Engagement Coordinator for the Harborside Health Center Medical Cannabis Dispensary here in Oakland. I think you're probably familiar with Harborside and recognize that it's the largest medical cannabis dispensary in the world with over 100,000 members, and is basically considered to be the gold standard of dispensaries. A lot of the patients, and so I'm here to encourage you to vote down item 18 and have it rewritten based on the merits of vaporizers and not on the unrelated issues of toxic tobacco. A lot of the communities, a lot of the people that I work with at Harborside are people from the senior community, a lot of people who are finding a lot of relief for chronic pain, cancer, lack of sleep, other disorders, arthritis, and things like that, are able now to turn to vaporizers as well as other delivery mechanisms to get the relief that they need because of the medicinal value that we can see from medical cannabis. And as we know, these medicinal values are enormous and growing as we learn more about them. And vaporizers are a new, safe, and very beneficial delivery mechanism for the application of medical cannabis. There are also a number of other communities like the vets are using them as well. Bob sort of referred to that obliquely in a way. And also baby boomers, who frankly, a lot of them grew up smoking cannabis, now have the opportunity to inhale without the dangers of smoke inhalation due to vaporizers. Finally, I want to let you know that I agree with the recommendations of the Castro Valley Municipal Advisory Committee and their 5-0 vote to rewrite the proposed ordinance. In particular, their items A through C. Item A was that vaping has not been proven hazardous to one's health. Item B was vaping is not smoke and cannot be considered a tobacco product. And item C was that vaporizers absolutely should not be lumped in with tobacco products because they are not in and of themselves tobacco products. So thank you very much for your consideration.
Thank you. Dale? After Dale, Dress Wedding, and then Liz Williams. That's Liz will be our last speaker on the item.
Yes, I'm Dale Geringer. I'm the director of California NORML, National Organization for Reform of Marijuana Laws, and I'm also on the City of Oakland Cannabis Policy Regulatory Commission. I got to say, I'm a little bit in the dark about what's going on with these ordinances at the moment because it was impossible to download them from the county website this morning. But if, in fact, they are like some preceding ordinances and like some of the state legislation that has been proposed in and have an overly broad definition of e-cigarettes to be any device that can vaporize nicotine or anything else, basically, then that definition is overly broad and is really harmful to the medical cannabis patients we have out there who are using vaporizers for harm reduction purposes. And I know whereof I speak there because I played a role in developing the use of vaporizers specifically for eliminating the harmful toxins in marijuana smoke back starting in the late 1990s, and sponsored studies that showed, in fact, that it was possible using electronic devices, vaporization, to totally eliminate in our studies all of the polyaromatic hydrocarbons and tars and carcinogens that are normally to be found in smoke, either marijuana smoke or tobacco smoke. Completely eliminated benzene, toluene, naphthalene, everything we tested for went on, and studies were sponsored by the Center for Medicinal Cannabis Research at UC San Francisco, showing that, in fact, vaporizers were a safe and effective method of delivery of medical cannabis and should be available to patients. So it's important that vaporization be available for harm reduction purposes and for medical purposes, and that these not be treated the same way as tobacco cigarettes. To call them tobacco products when they're being used for cannabis is just newspeak of some sort. It's totally wrong and incorrect, and I think we need a more careful examination of these products before just striking out in the way that has been proposed. So that concludes my comments on this.
Thank you. Dress Wedding, Liz Williams, and that is my last speaker, Liz Williams.
Good afternoon, Board. Mr. President, my name is Dress Wedding. I'm co-founder and Holistic Services Director of Harborside Health Center, and we are indeed the largest medical cannabis dispensary in the state and probably therefore the world. And I speak as well to e-cigarettes as a great delivery system for cannabis, and I would hate to see it lumped in as a tobacco device. It would tax our patients unreasonably and subject us to unnecessary hurdles. We face more than enough hurdles in maintaining our business and serving well over 200,000 patients between our San Jose and Oakland operations at this point. I will not take any more of your time. You've heard plenty of statements that I could only repeat at this point. Thank you.
Supervisor Miley.
Thank you. A few things. First of all, as the public health director pointed out, or public health department director pointed out, this is a framework for regulating e-cigarettes, but it's not an exclusive framework. We can come up with our own regulation of e-cigarettes by not defining them as tobacco products. Am I correct or am I wrong?
You are correct that you could do that.
Thank you. Thank you. There's no legal restriction for us to come up with an ordinance that regulates e-cigarettes similarly to cigarettes, but not define e-cigarettes as tobacco products. So everything, we don't want them in the hands of minors. We don't want them to do this. We don't want them to do that, et cetera, et cetera, et cetera, can all be accomplished by not defining them as a tobacco product. That's what I'm saying. Secondly, the mere fact that there are chemicals and this, that, and the other from e-cigarettes, we all recognize that. There are chemicals in this room. There are chemicals when we go out here into, I'm on the air quality board for the Bay Area. When we go outside and breathe this air, there are chemicals. We can stop driving. We can stop living. There are chemicals everywhere. We can stop using products. We can stop everything. But do we? No. But do we come up with regulations? Yes. Is it appropriate to define e-cigarettes as a tobacco product? No. It's a harm reduction device. And by calling it a tobacco product, you're demonizing it, and you're going to say to people, you shouldn't use this. And you're going to push people to want to use it. in a manner that's not appropriate. You're going to produce a chilling effect that will allow for folks that potentially wouldn't go to tobacco to go to tobacco and not be able to get off of the use of cigarettes and tobacco products. I think just the opposite. I think what's going to happen is we're playing into the hands of big pharma. We're playing into the hands of big tobacco. We're doing exactly what they want us to do by calling it a tobacco product. We are co-conspirators with them. And just because there are a lot of jurisdictions, there are a lot of people that are calling it a tobacco product, does that make them right? No. Does it make me right? No. Do we know for sure? No. So we can come up with our own best intelligence and best decision-making around what we want to do. Now, I respect what the board's going to decide to do on this matter. Doesn't mean I'm going to go along with the board. I'm going to vote my conscience, and everyone else will as well. But I'm trying to put forth a real strong argument that we can do the same thing with e-cigarettes that we're doing with cigarettes, but just don't call them, define them as a tobacco product. It's a harm reduction mechanism, and we don't want to produce a chilling effect on people trying to get off of cigarettes, stop smoking, or use this as another device, as someone pointed out, as an alternative to smoking. People are going to do this anyway. Folks are going to go for alcohol anyway, but we regulate it. And as I said, just because this is a delivery device for me to put alcohol in, do we call every cup, every glass that this is a delivery device? Now we're going to label it, mislabel it? No, we regulate the product. We don't regulate what the container is. And an e-cigarette is just a vaping product, a vaping device. Serena put one up here. It's just a device. We regulate the device. That's what I think we should be doing, and not demonizing it as a tobacco product and playing in the hands of big pharma and big tobacco and discouraging people from getting off of it. I feel strongly about this because I know it's just like in the early days of 215, Proposition 215, when I was on the Oakland City Council. I hadn't had to say this in a long time, but when I was on Oakland City Council, and we came up with the underpinnings for the medical marijuana regulations. We brought in folks that testified how medical marijuana helped with their illnesses. And there were people who didn't believe that, but I believed it, and we put in place regulations. It's the same thing here. There are people that are using this to save their lives. I know it for a fact. I believe it. And all we're going to do is discourage it and discourage it as an alternative. And we shouldn't do that. We should not do that. But we should regulate it, but not as a tobacco product. And we can achieve the same goal by not regulating it as a tobacco product. I really hope I don't crash and burn here this afternoon. But if I do, I've done my best.
So if you could help me, Supervisor Marley.
It's what I've tried to explain is that if
Please don't use the cup analogy again. I've heard it 3 times. I obviously that one's not sticking.
That one's not working.
That's not sticking. I want to know why you don't want it labeled as a tobacco product.
Because it's not a tobacco product. That's the bottom line. It's not a tobacco product. We are not compelled by any case law to call it a tobacco product. It's not a tobacco product. And by calling it a tobacco product, what we do is we discourage people from wanting to use it as an alternative to using tobacco. And we discourage and we put a chilling effect on folks who want to get off of using tobacco from using this as a way of getting off of using tobacco. And maybe it's not universal, but every bit helps. And we don't have, and Serena even pointed out, we don't have the definitive research that would take place over 20 years to make a determination one way or the other in terms of what the health issues are going to be long-term associated with e-cigarettes. So my position is, let's regulate e-cigarettes, but not as a tobacco product. But let's indeed regulate it. And if we find out definitively, we can always alter and amend our ordinance, as opposed to putting in effect a situation that makes it so folks who want to get off of using tobacco don't, or folks who want an alternative don't. And as a harm reduction approach, I think one of the speakers who was a teacher pointed it out. We've regulated sex education and drugs by trying to provide condoms, trying to provide needles as a harm reduction measure. Because people are going to smoke, people are going to experiment with that, and this is an alternative. This is an alternative. And I don't think we should be trying to proffer off of an alternative by putting more money into the tobacco settlement fund by calling it a tobacco product. And clearly the tobacco companies and Big Pharma would like for us to do that because they'll benefit from this. They'll benefit from this.
I'm going to vote against the item, just to be clear, because I think I still had questions. But having said that, is it your intent, Supervisor Miley, that we then direct staff to come back with an e-cigarette ordinance?
That would be my intention. We haven't, as the public health director pointed out, because the health committee kind of took jurisdiction over this, took it away from the unincorporated services committee, of which the ordinance will apply in the unincorporated area. The ordinance that was advanced came out of the health committee, so we couldn't get another ordinance drafted by county council to present to the board. But if the board, as Montu pointed out, votes us down, then it'd be my intention to try to have the staff prepare an ordinance that addresses e-cigarettes as a non-tobacco product, but with the similar regulations and a similar scope and magnitude.
And then legally, counsel, do you think that that's an ordinance that would hold up?
It would be our endeavor if we drafted an ordinance to draft an ordinance that would hold up. Yes.
All right. We have a motion before us. The title was read very early on, so you don't need to read it again. You read it already once. So with that, all in favor, please state aye.
Aye.
All opposed?
No.
Motion fails, 2 ayes, 3 noes.